It's still morning. Good morning, everybody. Thank you for showing up today. Got some updates for the community on COVID, on flu, and again, where we're approaching the next couple months, and how we're going to actually hopefully respond to that. So let me start off by COVID and the issues that we might be seeing over the next couple weeks. As we saw back in the 4th of July, we all kind of lived our lives, which was really important. And we went out to parties, we did mass gatherings, we did things, and we lived our lives. Unfortunately, the data shows that, again, as we would expect, a couple weeks after the 4th of July, we saw a significant increase in cases of COVID inside of our community. These are the confirmed cases. We were dealing several days in a row of well over 100 cases that we were looking at and having to follow up. And that lasted for a while. So again, I want to make sure that the community at least understands that as we approach this holiday weekend for Labor Day, that we really take it upon ourselves and protect ourselves, but protect our community as well too. Again, mass gatherings we know are a concern, and it's easily spread. COVID's easily spread from person to person at these mass gatherings. So please, if you don't need to go out, please don't. If you are going to go out to parties and things like that, please take precautions. Again, face coverings are so important now. We're getting more and more data back and research that face coverings are helping with a decrease in COVID cases. So again, please, if you're going to go out and you're going to live your lives this weekend, as we all need to, we need to make sure we take those precautions. Again, social distancing, making sure that we know where we're going and who we're going with, making sure that, again, we have good hygiene. And again, really thinking about, if we don't need to go to that mass gathering, that big party, let's not, because again, it will protect us in the long run. I would fully expect us to have cases again over the next couple of weeks after the Labor Day weekend, but I'm really hoping that we don't see significant cases because again, it just hurts what we're trying to do with our schools, with getting back to a normal life, if you would, and moving our community forward to make sure that it's healthy. So again, the holiday weekend, go out, enjoy yourself, but let's all take our personal responsibility to make sure that we don't become an additive to the problem of COVID in our community. So let's talk a little about numbers and where we're at. And again, we haven't done this in a couple of weeks, so I thought it would be important to just give an update, especially before a lot of schools return. We're starting to see athletic events. So we are seeing some good trending number right now, data. We're not at 100 anymore, but we're still significant in the community in the sense that we're not below 20 cases a day that's being reported to us. And that's really where we would really like to see. We'd like to see under 10. And again, that gives us the ability to really affect how we do things in our community. So again, we as individuals every day, not just because of the holiday weekend, need to make sure that we're taking those precautions of wearing a face covering, social distancing, and again, making sure that we're doing good hygiene all the way around, because we want to see this trend continue. Why is that? Because again, we talk about getting back to life, and we really need to, but we were going to start having kids go back to school. Some schools are already back in session. Others will be going back here in the next couple of weeks. Some schools are playing sports, which is great. We need to do that. But the only way that we can keep schools open and we can keep sporting events continuing, that Friday night football, which we all love, is to make sure we're reducing the disease in our community, continue to have a downward trend of making sure that we have as little cases in our community as possible. Because what happens, like the governor, you heard the governor say, what's going to happen in our community is going to happen to our schools and to our businesses and things of that nature. So again, I really applaud what Lucas County is doing. I see a lot of people wearing face coverings. I see a lot of people, social distancing. But again, we just gotta do even a better job of that to be able to knock COVID down even further, so that we don't continue to have immense issues as we go through the next couple months. Why is that? I want to talk a little bit about flu. As we know, flu season is going to come about sooner than later. We're already in September. We're looking. Flu season starts about now into October, especially towards the holidays. We know that flu season happens every year. The problem is we don't know at this point in time how significant the flu is going to be. Last year was a very light year for us, and luckily it was a light year because we had COVID towards the end of the flu season. So that was good for us. We don't know how it's going to be this year. In the United States last year, we had 24,000 deaths. And again, one death is too much from flu or from any disease. But again, unfortunately, 24,000 deaths equals kind of a light year. Back in 2017, 2018, the United States had 61,000 deaths from flu. So you see every year it bounces around. We don't know where it's going to land. We don't know how many deaths. We don't know how many hospitalizations. We don't know how people are going to get sick, but we know that it's coming. And what can we do for that? Well, again, this year, as with every year, but even more importantly this year, we are going to talk about flu vaccinations and how important they're going to be. COVID deaths so far, about 185,000 in the US. Last year, flu deaths, 24,000. A couple years ago, 61,000. So you see, if we still have COVID, which are going to have COVID in our community, we're going to have to work with COVID, but we're also going to have to work with the flu. Having both diseases at the same time, as I said before, that's going to be tough on anybody. So how do you protect yourself, at least from the flu? We have a vaccine. So we talk about this every year. Getting vaccinated is the best way to protect yourself from getting the flu. And the vaccine's already out. Matter of fact, just heard from the Ohio Department of Health today that they are shipping our vaccines. We've ordered our vaccines here for the department as well through the private stock. And vaccines already out in the community. So again, I'm urging everybody who can get the vaccine for flu, please do. The less flu we have in our community, the more that we can focus in on COVID issues that we're going to have. And remember, the bottom line here is to prevent the hospitals from getting inundated with cases. We know we're going to have flu cases. We know we're going to have COVID cases that go to the hospital. We know we're going to have flu and COVID mixed that are going to go to the hospital. The more we can do as individuals to, again, protect those hospitals from utilizing resources, the better off we all are in a community, because they can respond to what they need to do. And those are those life-threatening issues that we're going to have in Lucas County. So what else can we do for flu? And we've talked about this every year, but we'll go through this again. Again, it's keeping yourself as healthy as possible. It's still getting enough of sleep, eating right, making sure that, again, you're getting plenty of sleep. You're de-stressing as much as possible. And in this day and age, I know it's hard to do, but again, it's important for us to do that. Again, I'm hoping, because again, we're using hand sanitizer, we're using face coverings, we're washing our hands more, we're more in tune to not getting sick. I'm hoping that that's going to allow us to maybe have less flu cases in the community. But again, it's important for us. If we're not doing those things, we're going to see flu cases. We're going to see COVID cases. So again, protecting yourself from flu, protect yourself from COVID, kind of the same thing, except please, 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 if you can't, get the vaccine for flu. Talk to your doctor. Again, if you can get it, please do. So why is this important? Again, I want to circle back around a little bit to our schools. Our schools are amazing in Lucas County, just like our hospital systems. Again, it is a true wonder of the working relationship we have with everybody in our community. But again, they can't do it alone. They really need our help to make sure that we're doing the best we can to keep COVID out of the schools, and again, to help the hospitals make sure they can respond when they need to. Appropriately. The schools have been working on plans. They're really good from start to bottom, from start to finish, excuse me. So again, we need to help them out as much as we can. They are going to have cases, ladies and gentlemen. You're going to hear about school A, school 4, school X, whatever it might be, that there's a case there. It doesn't mean, much like the governor said yesterday, it doesn't mean that they actually got it within inside the school. It's probably what we're seeing right now is community spread. It happened someplace else, and they just happened to be a student or somebody who works someplace in that school system that has gotten it. I would expect eventually we might see spread within inside of the school system, but again, it doesn't need to impact them negatively from a standpoint of, oh my gosh, school A has a COVID case. We need to make sure that, again, we do the best we can to keep it out of the schools, but understand that they are going to have cases and we will hear about them. And again, like the governor said, we need to be as transparent as possible to make sure that, again, the community understands what's happening. Again, we need to take it upon ourselves to make sure that we do the best we can for the schools, and that means doing the things we've talked about. Again, face covering, social distancing. I want to have a real quick discussion on where we're going to be in the next couple weeks with contact tracing. We are seeing, like I said, a little bit of a decreased number, so we can kind of take our breath here a little bit, but we're nowhere near where we need to. Contact tracing, we continue to add employees on for contact tracing. So as we move into the flu season, as we move into school starting back up, we're going to have an increased ability to respond. And that goes back to what the University of Toledo has relative to their contact tracers that we're utilizing, as well as internal staff. So again, we are working to make sure that the contact tracing is to the highest degree possibly can be for our community, because that is going to help us control as much as we can control COVID within inside of our schools, within inside of our businesses, within inside of our community. Because if we can find out more about what's happening for individuals who have either tested positive or are sick with it, who their contacts are, and the quicker we can get them to be either quarantined or isolated, the better off we are to controlling COVID within inside of our community. And that goes to the issue of, we're hearing some stories that are a little disturbing. That we have people that are going to work and they know they're sick, or they might be positive, and they might be, going to work, or again, not wanting to get tested because they might again, not be able to play sports. We'll talk a little bit about high schools and sports, or they may not be able to go to school. The issue with that, and I understand that, I really do. The issue with that is, if you're bringing COVID into the school or onto a sporting team, that impacts that sporting event, that sport itself, that school, that classroom. It really does impact that. So again, it should be our personal responsibility relative to our kids and ourselves. If we're not feeling well, if we think we might have COVID, we need to make sure that the school understands that's happening and that we're staying at home. So I guess the bottom line is what we've talked about. If you're sick, stay at home, because that's just going to compound the issue. If it is a COVID concern, going to compound the issue within inside of the school, of that sporting event, or even where we work. So with that said, Shannon, I do believe that was kind of what we wanted to cover with our bullet points today. Do we want to open it up for questions?
Yes. Media, if you want to go ahead and unmute yourself and ask your question, Melissa Veitch.
Hi, Eric. It's Mel from ABC.
Yeah.
Couple questions as a follow-up. Can you go down that road a little bit further as to the reports that you're getting, that it sounds to me like it's specific to sports teams, kids who don't want to get tested because they'd be excluded from that sport?
Yeah.
And then I have a follow-up.
We've had a couple examples of that in the community, and the schools are battling that very issue as well too, because they understand that again, if they don't have a good handle on those individuals who could have COVID, and they enter that team atmosphere and or the school atmosphere, they're going to run into problems. Again, it is really important that for those couples we've already addressed, we don't want to see any more. We've already addressed the couple that we've had in the community. It is really important that I know it's tough to not have your child play a sport, or even that child wants to play that sport. But it's really important to the rest of the team and into the school and to the community that again we make sure that we don't play that sport or to go to school if we're sick. I'm hoping we don't have any more of those cases, but again, it's really important that we think about it as parents and even as students. We think about it as parents and students, that if we are sick, we could be bringing that illness to our teams and to our friends and into our schools, which means then it could be even more people who would be isolated or quarantined in that team. And then I would hate to say this, but then forfeiture, or, in the school system, we've already talked to schools about this. There is a certain aspect and at a certain point where classes could be, again, canceled because there's just not enough of kids in that classroom who aren't quarantined or isolated, that you're not going to be able to have that class and or schools. So again, we're all fighting the battle of making sure we keep schools open and we keep sports going. But again, I can't stress this enough. It is really our responsibility as individuals to adhere to, good logic, good science, and not wanting to bring this disease to others who, again, we're friends with, we're teammates, we're fellow students, we're part of the community.
Okay, thank you. And then
Sure,
my
ma'am.
follow-up just is, can you give us a succinct look at where we stand in Lucas County? It's, are we going to drop from red to orange, that kind of thing?
I track the numbers daily, actually a couple times a day. It's tough when we continue to stay red. There's some other counties that have dropped from red. Cuyahoga County is one of them, dropped from red. There's other counties that have dropped to red, but I'm still on the premise that what happened 4 weeks ago to them is what we're seeing now. So I'm hoping that we continue down this road of having less cases. I got to tell you, everybody, we're still at 112 per 100,000. That's significant. And again, we need to take it upon ourselves to decrease that 112 even further down below that 100, because if we don't go below that 100, we're not going to come out of red. But what does that mean? Because we're 112, is 99 good out of 100? No, we really want to see below even further out of that 100.
Okay, thank you very much.
Hi, Eric. So I'm wondering if you have like a concrete date when flu vaccinations will be available through you guys at the health department.
Yeah, we weren't allowed to order our flu vaccine until September 1st, and so that's ordered. I would imagine it's going to take a week or two to actually receive that vaccine. I do know that ODH, like I said, is shipping theirs, so I would imagine probably by the third week of September, we'll definitely be able to get flu clinics up and running. But again, it all depends on how the logistics are with the vaccine.
Okay. As far as schools, I know a lot of schools, kind of had dates where they were going to kind of reconvene and decide what they're going to do moving forward. September, mid-September was kind of a lot of those dates. I guess, since they've started virtual learning and now that those dates are quickly approaching, what have conversations been like as far as taking that next step to bring students back?
Sure. We have pretty much a weekly call with our schools, and especially our public schools within inside of Lucas County. So again, I'm having one tomorrow, and we'll bring up some issues, and we'll have that very discussion as well too. Again, we're still red. We're still significant relative to our numbers on a daily basis. So again, what the board has decided on that October 1st date, it still holds true. We're all kind of thinking by this time we might be out of the red zone. We might be seeing better numbers with the daily cases, but we've kind of plateaued a little bit here. And again, that's the issue. We're not seeing a significant movement from what we saw a couple weeks ago to the point where I think the board can say, yeah, maybe we can change our recommendation at this point in time. But I want to make sure the community understands the schools are taking every precaution they possibly can, and they're doing the best they can with what they got. And this is a situation where, again, you get COVID into a school, and it's hard to get it out. So again, we need to make sure that we're helping the schools out as much as possible.
Okay. And then the last question that I think a lot of people are just wondering at this point, when is everything going to end? When are we going to go back to normal? I feel like it's, we're still expecting a vaccine, 2021. Is that pretty much when we can expect things to kind of trickle back to normal?
Again, I wish I was the owner of the crystal ball, which can say all this, because again, that would make my life a lot easier and everybody else's. As you know, every time we turn around, there's a different wrinkle in the COVID concern. Let me try to answer the question as this. The best possible time we could probably get a vaccine. I'm hearing rumors that maybe by the end of the year, but I'm thinking early in 2021, we'll see a vaccine But again, there are so many issues with that. How many people are actually going to want to get the vaccine? How effective is the vaccine? So just because, you know, we get a vaccine doesn't mean that this is going to end by the middle of 2021. I got a feeling, you know, we're going to see this for the next couple years, not to the, I don't think to the significance that we're dealing with it right now, but just because we get a vaccine out doesn't mean that this is all going to go away. There's a number of things that we need to do, get the vaccine out, get people to get the vaccination, continue to do the things that we're doing, wearing face coverings and all this other stuff that we're asking you to do. And I know that it's difficult, but again, we're trying to get to a place where we can fight the disease even better. So if you want me to bet on something, I'd say real normal life, probably 2022. Again, that is just, I'm throwing that out. I mean, real normal life. I think end of 2021, we're going to be even better than we are right now, but to what extent? So.
Thank you. That's what I had.
Sure.
Hi, Eric. Ruth 24 here.
Hey.
I have two questions. Can you
Okay.
hear me actually? Oh,
Yes.
yeah. Okay. Sorry, it still said Amy. First of all, what are our averages for the day now? Are we still at about 20 cases a day, or what's that looking like?
So again, here's the issue with the averages is that, again, we're still seeing some lag time with testing. So let me give you last week's averages. We were close to 50 for every day for confirmed cases. So this week, again, we don't have all the data in because of those lag times. We're probably closer to 40 at this point in time. So you kind of see us, we are coming down, and we have, you know, let me state this differently. We go up, we come down. We go up a little bit, we come down. We go up, we come down. So we are seeing a downward trend to that 40 average, but I don't want to, you know, again, stress that 40 right now because I don't have all the data in from the last couple of days. So if we look at around 50 on the average, we're probably better off.
Gotcha. And then
Right.
we now know that there is this testing that's going to be done through the Wexner Medical Center in Columbus as a part of that nationwide testing with the University of Oxford and AstraZeneca. What does that mean that it's here in Ohio? Does that mean that we, you know, could be seeing that vaccine a little earlier, or does that have any significance with it being just, you know, 2 hours south?
I think, again, the significance, I think, is that it's asking Ohioans to, again, maybe partake in the study. So we'll get a sampling of our residents in that. I think, again, too, it shows, again, the significance of Ohio in what we bring to the research capacity that, you know, again, we as Ohio are being asked to participate. So again, I think that's the significance. I don't think what it does, it doesn't give us a leg up on getting the vaccine any quicker. It just allows us to participate.
Perfect. Thank you.
Sure.
Eric, you have a few questions from Facebook about Lucas County positivity rates.
Sure.
Can you talk a little bit about that, please?
Sure. So positivity rates. Positive rates are the, if you would, the positive cases versus the negative cases from testing. So what we saw when we were doing our testing out in, what was that, at University of Toledo, what we saw, it was 10%. And so what we're seeing right now, again, the best possible data that we have, because it's hard to track, is probably around 5%. We saw a spike, you know, again, with our testing. I think just because of the sheer numbers and individuals who wanted to come be tested that day. So again, I think our best number right now is around 5%. And by the way, we really want to see 3 or south of 3 for positivity rates.
Thank you. I don't believe that we have any other questions from our media, and the positivity rate was really the only question that we had on Facebook at this point in time. So any closing comments or remarks?
I guess just from our perspective, enjoy the holiday weekend, but please remember the decisions that we make as individuals relative to the COVID issue will affect our community, will affect our schools, will affect our sporting events. It does come back to our community and have an impact on what happens. If we want to get out of red, if we want to get back to some sort of normal life, we really need to lower the COVID infection rates even more than we have. So Shannon, I think that was the closing comment.
Got it. Thank you, everyone.
Thank you, everybody.